1, 2, 3.
Greetings and welcome to this third edition of the Kokayi Academy for the Healing Arts. Today I want to discuss three of what I call crossover cases. They're cases that have typical allopathic diagnoses which are usually treated by biochemical means with drug therapy. But instead of using drugs, I want to show how simple manipulations of this guy here, your vertebral column, actually made a difference. And this is the type of skill set that chiropractors and osteopaths actually might use to approach a problem. So why am I bringing this up? Well, I'm kind of amazed and repelled by the fact that there are so many divisions with respect to knowledge base, with respect to what's considered worthy of study, worthy of application in a clinical setting. Where you have practitioners of all ilks have therapies and techniques that can help people on so many different levels. So basically, as I've come across different therapies and diagnostic systems, I've been able to classify everything within four subsets: therapies and diagnostic therapies and systems that focus on the biomechanical aspect of the body, where we're talking about chiropractic, osteopathic, massage therapy, craniosacral therapy. That's on a biomechanical level, even surgery, right? On a biochemical level, of course, we have food, we have water, we have the effects of supplements, the effects of drugs, botanicals, all these things that have primarily a biochemical focus. And then the third level is a bioenergetic one. The fact that we have channels of energy that run through our body create all kinds of electromagnetic fields around us that interface with our environment, that carry information, both information that we're putting out, whether it's emotions or information that we're picking up in terms of other energies and thoughts and feelings. And then there's a fourth level, which is really amazing, and I look forward to talking about this in other sessions when we talk about the field of consciousness. The field of consciousness and your awareness, your level of awareness, your ability to embrace certain levels of consciousness, certain realities, and how that can impact illness and health, and how that can literally regenerate your body on many different levels. We'll come back to that. But today, my crossover cases involve, first one, these are just clinical vignettes, right? Really encapsulated stories that I'm trying to give you to make a point. I had a young man about 19 years old. No, he was actually 21 because he was just finishing school. He was going to go into a musical internship. But he was complaining about palpitations, right? Palpitations that were enough to disturb him. Then he went to a cardiologist, had a workup. I believe the most that was prescribed for him was a beta blocker, something that would help to control the sinus rhythm, the initiation of that heart rhythm. But his family decided they wanted to get a second opinion. So just in terms of the medical intake, if you think about it, he's having heart palpitations, right? The heart involves certain what are called dermatomes. Now if you look on my spine, here we have a lumbar spine, we have a thoracic spine, and we have a cervical spine. Now, if you can imagine, this is the head, the back of the skull, these are the pelvic bones. So the heart is somewhere in this area, right? You're looking front to back. So the heart will be somewhere in this area. You have nerves that come off the spine and go around the chest, around the rib cage. And these nerves are actually, they're coming off the spine, which is encased by this skeletal, mesh that's here, this hard bone, right? But at the same time, the nerves are coming off of these little foramen right? And these nerves then are circulating around the chest and lower back and down the legs. The problem is that if you can imagine what a pinched nerve feels like, but we usually associate a pinched nerve with something happening with an arm or something, with a limb. We don't necessarily associate symptoms of a palpitation with having a pinched nerve, a nerve that might be affecting the heart rhythm. But in this case, I found what we would call a subluxation. Now, a subluxation, depending on the medical specialty, will have different meanings. But within a more of a chiropractic framework, it means that there's some kind of partial joint dislocation or shifting. Now, it's not hard to imagine that with any kind of torquing of the spine, that you might impinge on the nervous outflow and thus affect, whatever functions are controlled or mediated through that nervous energy. So in this case, as part of my examination, beyond the blood pressure, beyond an EKG, or just listening to the heart, we wanted to check the actual mechanical structure. And we found a subluxation between the fifth and sixth thoracic vertebrae. So through a simple chiropractic type correction, this patient noticed a sudden change in the energy around their chest and just how their heart and that area felt, and that problem was solved, and there was no need for medication. The point being here that through a mechanical assessment, we were able to arrive at a solution that if you approach your regular MD with that, they're not going to really think about checking you on that level or having you checked on that level. That makes no sense at all to me. Relative to the training that different health professionals are receiving. Guarantee that a chiropractor would probably know that, this person needs to go to the cardiologist, right? But at the same time, that simple structural correction in this case was actually what was needed. Second case involves something that we would call chronic fatigue, right? Patient presents with chronic fatigue and chemical sensitivity, something that's more and more common as our food is more adulterated, our soil is more deficient, we're having more and more reactions. Now, what was interesting in this person who really suffered from generalized weakness, when I checked the energy flow along the spine, and that's it for another conversation in terms of really what that means. But suffice it to say that there were multiple subluxations along the spinal cord. And when I just did a general treatment to stimulate the muscles along the vertebral bodies, you have paraspinal muscles that run, on either side of the spine. Just from stimulating that, her fatigue level went markedly down, which tells you that part of the therapy for the chronic fatigue is from a structural level with a group of patients that respond to this, is that you want to lengthen the spine. You want to really open this up, right? Because we're talking about dermatomes and nerves coming off the spine, but within the spine is a channel of energy, right? Because you have the nerves conducting, which generates an electromagnetic field, one of the most powerful around the body. So to open up the spinal energy and have that energy flow, whether you're calling it kundalini or the governing vessel in Chinese medicine, that can have a profound impact on any number of conditions. The last vignette that I wanted to share is basically a patient that had a clinical diagnosis of ulcerative colitis. Now, this case is a little bit unusual. I was invited to speak at something that was billed as a Millionaires Conference, right? That was organized by people that are multi-millionaires, and they bring in different people to actually speak and share their craft. Well, it happened that one of the people that organized this, his wife has ulcerative colitis, and she had been having diarrhea for like 2 weeks. She didn't want to take regular medication, but she wasn't doing well either. So they actually asked me to see her. And when I did my intake, what do you think I discovered? Well, from a structural standpoint, she had multiple subluxations in her lumbar and thoracic spine. And since this was an integrative medical exposition, I spoke to one of the chiropractors there and asked him to do the appropriate adjustments to her spine. Well, lo and behold, her ulcer, her diarrhea actually cleared up, and cleared up within a day. She was fine. And the big kick for me is that I believe they gave me a check for, it was either $5,000 or $10,000, right, to donate to whatever charity I wanted. So I got a big kick out of that. That was my experience at a Millionaires Conference. But the point is, and that's another piece here, is that a lot of times folks that have means, that are aware that there are other ways to take care of the body other than just taking drugs, they are looking for more integrative approaches to their health. So for those of you listening, just think about this. We talked about 3 problems where there was benefit to the client from doing a structural assessment and adjustment to things that are usually considered biochemical in nature and are generally treated that way by doctors. So keep that in mind, and I look forward to sharing another episode with you in the upcoming weeks. Take care.